سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. We want to welcome all of you again to our episode of Health and Lifestyles. Today we'll be briefly talking about or discussing about immunization. This is the ability of the immune system of the body that it has antibodies. These are the agents that actually fight against diseases so that it can be able to eliminate a disease that wants to get into the body. So basically, by introduction, immunization basically is the ability of the body to have antibodies that can fight against diseases. And this immunization, actually the body can get it through either what we call active immunization or passive immunization. And in brief, active immunization is whereby the body actually it gets into contact with the immunogens, things that actually will force the body to produce the antibody so that it can fight the diseases. This is whereby the body, for example, gets into contact with the microbes from the environment. For example, some people in areas where there's a lot of malaria, because they have in constant contact or they get the malaria parasites, some of them actually build some antibodies against malaria. So you find that people who live in areas like in Western Kenya, the Nyanza, and at the coast, they can have higher immunity to malaria than people who do not live in areas where there's malaria. And this is because they have been getting into contact the mosquito that actually bite them. They inoculate or they put into them the malaria parasites. And because of this constant contact with the malaria parasite, the body actually produces some antibodies against the malaria parasite. In other cases, it could be microbes, for example, the flu bacteria that gets into contact with the person. So for some time, because the body has been having or faces these microbe, it actually produces antibody against it. So this active immunization is whereby the body gets into contact with a particular microbe. It could be a bacteria, it could be a virus, and then the body actually produces antibodies that can fight against that diseases. In passive immunization, this is whereby actually the body immune system cannot produce these antibodies, but the antibodies actually they're inoculated into the person so that it can fight against a particular diseases. So for example, if somebody wants to protect somebody against a particular microbe, you put the antibodies into the body, and then the body actually has sustained these antibodies for some time, but it is short-lived, so that when it gets these microbes against which the antibodies were put, it will actually fight it. So these are the major ways where the body gets immunization from. And the good thing about the active immunization is that when the body is challenged by putting some parts of that microbe or some part of that virus or bacteria that will challenge the body, it produces it in the body. This becomes long-term, and the antibodies are not removed by the body because they're being produced. In passive, this will need for the person, if were to be protected from the same microbe, they need to be inoculated into the body from time to time, because this is short-lived and the body does not produce them, and they're being removed, they're being broken down by the body. The importance of immunization is that we know it prevents somebody from getting several diseases, and we'll be talking later about some of the diseases that actually are given as a routine immunization in Kenya, and there are others that are given as a supplement, and there are others that are given according to either to a potential outbreak or to prevent somebody from getting a disease from an outbreak that has occurred. And most of the time, this immunization is actually put into the body through vaccination. So vaccination is actually the act or the process of whereby the person is being inoculated, that is either being injected or being given through the mouth, because there are different routes where we actually administer or give the immunization. And the more common one is through the skin, where somebody is injected. The skin, it could either be just below the skin, what we call intradermal. It could be just above the dermal area, where that is the area called subcutaneous, so it is subcutaneously put. Then many of them are put through the muscle. It could be the muscle at the hand or the thigh area, so it is given through intramuscularly. And there are some, like for the ones which we give to protect from polio, are actually given through drops, and this is given most of the time to children. And even during campaigns where we have several campaigns to give these children the oral polio, so that they can build the immunity against poliomyelitis, that is the polio disease. So these are some of the routes that actually we use when we want to do a vaccination. And through this vaccination, then it leads to the body actually producing the antibodies, and then the person becomes immunized against these diseases. And the importance of immunization, actually, it's one, it protects one from getting the diseases. It has also been proved to be very effective. In some countries, actually, diseases like, for example, polio, they've actually been eradicated. They've been removed completely. The diseases like chickenpox, some area through immunization, they've actually been eliminated completely. And we know that once somebody is given, some of these immunizations are actually lifelong. For example, the yellow fever currently being given after 2016. We know once a person has been inoculated with the yellow fever immunization, this current is lifelong. So they have long-term benefits. Then even they are cost-effective. Looking at a person who has a particular disease or could even die from a particular disease and is prevented from getting the disease, is prevented from dying from the same disease. So in the long term, it's also cost effective comparing whether the person has a disease and needs to be treated or has a lifelong disability. For example, poliomyelitis, when a person has some weaknesses, especially of the legs or the arms, and sometimes even breathing problems. So we're looking at prevention is better than cure, and even the cost, it is better. So we know that this immunization in the long run will reduce the cost, and the bigger population will actually be healthy, and this will lead to a healthier society and to better nation development. And this, it can be accessed through most of the public facilities, even the private facilities they give. So the issue of availability is there, the issue of accessibility is there, in terms of distance, in terms of the physical place where a person can go, but also it is accessible in terms of the cost, because most of them are not costly, and they are given, most of them, either once, twice, or some of them up to 4 times, so that you can get the full immunity. So it is important that, especially to our children before 5 years, we know there are different schedules for the children to be given. So it is important for all of us to know that at what particular stage a child needs to be given the vaccination, so that actually the child can go, so it can be prevented from getting these diseases, and so that this child can actually develop normally and should not get these diseases, which are actually preventable. So it is very unfortunately some of our children get these diseases which could have been easily prevented just through vaccination. And for us in Kenya, we know we have what we call the Kenya Expanded Program for Immunization. There is a schedule at which children are given this immunization. For example, at birth, we give children vaccination against TB. The child is given at birth, so that does not develop tuberculosis. And we know that for children and the very elderly, they are easily infected by TB microbes because their immune is still low or it is still young, and they can easily get these diseases. Also at birth, we also give what we call the oral polio virus vaccine. This is the OPV, and it is given at birth. Then there are booster immunization that are given at later stages. This is at now at 6 months, it will be given. At 10 months and at 14 months, the child also be given other boosters for the OPV. Currently, the country, we're actually moving to the IPV, which will be given actually intramuscular, so that we can eliminate polio. We are moving towards eradicating polio in Kenya. Then after that, we know there is another vaccination that is given, the DPT, that is the diphtheria, pertussis, and tetanus. Some of them actually also combine with hepatitis B and Haemophilus influenza, that is the HIB, which they prevent several diseases. And this is the diphtheria, that is the whooping cough. Then diphtheria, then the pertussis, which is a whooping cough. Then we have hepatitis B, and we have the Haemophilus influenza. So once a child is given this, it's given at 6 months, 6 weeks, then at 10 weeks and 14 weeks. Once the child is given this, is actually protected against these 5 diseases, so that the child in later stages has the antibodies that can fight these diseases, that is the diphtheria, the pertussis, the tetanus problem, the Haemophilus influenza, and the hepatitis B. So once the child is inoculated, it will develop the immunity against these diseases, and will not, in most cases, not get these diseases. And even when they get these diseases, they'll be at a mild stage. It will not be as severe as it can be when the child is not inoculated with these diseases. Once these at these stages, then there are other immunizations that are given, so that they can also be protected against these diseases. Currently, we also give them PCV, that is the pneumococcal vaccine 10, to prevent about 10 different types of influenza, so that they do not get these diseases, that is the influenza that they could have gotten from these particular microbes. Then we know that children, and also the elderly, they are easily infected by pneumonia. And once they're given this PCV10, they will be protected from getting this disease, and they'll be more, have the herd immunity against pneumonia. We're going to break, and once we come back, we are going to finish the other routine immunization that they are given in the Kenya Expanded Program for Immunization, so that we give the routine, then later we'll see which of these other immunizations that they are given, so that they're being protected, but they are not in the routine immunization schedule that they are given in the Kenya public hospitals. And once we come back, we'll elaborate on the timings and the route that they are given. Assalamu alaikum. Assalamu alaikum warahmatullahi wabarakatuh. Welcome back to today's series about where we are talking about immunization in our continuous program on health and lifestyles. As we had started discussing earlier, we were talking about the routine immunization that they're actually given in Kenya under the Kenya Expanded Program for Immunization. And we had discussed, or we had mentioned, the issue of BCG. This is an immunization that is given against TB at birth. We had talked about the DPT, sometimes combined with hepatitis B and Haemophilus influenza. That is, the DPT is a diphtheria disease that actually affects the respiratory system. Then the pertussis, that is what we normally call a whooping cough. A child has a cough that is deep and very difficult, and comes with a sound that is loud. That is the whooping. Then the tetanus, which children get, especially when one is cut with something that has been infected by the tetanus toxoid. So the person gets tetanus, and basically once a person gets tetanus, the muscles actually become stiff, and he has spasm, and sometimes even the bones actually can break because of this spasm. Then the hepatitis, we know mostly through blood products or the blood itself. A person can get hepatitis. Then the influenza, basically from the environment. So the DPT with hepatitis and the Haemophilus influenza, it protects a child against these 5 diseases. We had also mentioned the PCV10, that is the pneumococcal vaccine, which actually protects a child against pneumonia, especially from the 10 targeted microbes for this pneumonia. It protects the child so that it doesn't get the pneumonia. This vaccine currently also give it to the elderly because we know the elderly, their immune is down, so we protect them against the pneumonia by giving them this PCV10. Then other immunizations that are given in the routine schedule is the measles, mumps, and rubella vaccine, which basically protects the child from the measles disease, from the mumps, and also the rubella. And this is given at 9 months. So once the child is at 9 months, he should go to get this immunization. And then we also give vitamin B. And the vitamin B is actually given through the mouth, that is like a droplet, and it's given in our schedule from 6 months, and from 6 months the child is given every 6 months. That is after 6 months, then at 1 year, 1 and a half, 1 year to 1 year and a half, then to 2 years, up to when the child becomes 5 years. So after every 6 months, the child is given vitamin A. And this basically protects the child from having one, night blindness, because it protects the membranes that help the child to see well under the skin. So the child should be given this vitamin A up to the age of 5 years. So it is very important, any child who's below 5 years, to be given this immunization, especially the one that are in the routine. There are other immunization that it is good to be given, and they are available, although some of them are not in the routine, like the rotavirus, which protects children from some of the diarrhea caused by the rotavirus microbe. Then there are other immunization, like for meningitis, the Menacta 1, that is given at around 15 months. These protects the children from meningitis, so it can be given, although it's not in the routine schedule, but is one of the good immunization that can be given. Then at 2 years, a child can be given the typhoid vaccine. This basically protects the child from the typhoid fever, especially because of contaminated food that is eaten. So the child can be protected from typhoid. This is not long lasting. It will be repeated after every 3 years, so that the child or the person could be protected from these diseases. So these are some of the non-routine immunization that they're also given, and they're also important. We also know that depending on the circumstances or the outbreak, there could be some immunization that they're given at different times. Currently, we have started piloting giving the malaria vaccine in some 8 counties in Kenya to see how the people there, the children, will be protected against malaria. This is at the after pilot stage. Once the efficacy, the side effects are known, then it can be rolled out. We know there are other immunization that are given in some certain areas, but not in all the areas. For example, a yellow fever, it is basically given in the areas in Baringo and West Pokot. And currently, the country is thinking of expanding it to Turkana and Elgeyo Marakwet counties. So this is one of the immunization that is given to those 4 counties, but it's not given throughout. But we know during different circumstances, for example, especially traveling to other countries that actually yellow fever is a must. So if you're not been immunized for yellow fever, but you're going to a country that it is a condition, you must be immunized for yellow fever. You must go and get the immunization before you travel to that country. And it is good to know what time duration does some of this vaccination after you have been vaccinated, they actually start protecting you. For example, yellow fever, if you are to travel outside, it is important that you are actually immunized 10 days prior to your traveling date, because that is when it actually started being effective. So it starts protecting you from that disease that is yellow fever. So you need to be vaccinated 10 days before so that you get it. We know during travel, there are different countries that actually need you to be vaccinated against different diseases. For example, people who are going for Hajj, they're going for pilgrimage, it is important that they're inoculated, they're vaccinated against meningitis, they are immunized against polio, they are immunized, you're given the yellow fever, and you're also protected against hepatitis. So depending on the countries that you are traveling, they have their own different conditions. So it is good if somebody is to travel outside, you know the country that you're traveling to, which are some of the immunization that is a must for you to be immunized, to be vaccinated before you go there, so that you can get the immunization, the immunity against those diseases. We know during certain outbreaks, for example, there could be a cholera outbreak. Beside that, you need to prevent it. You need to protect yourself against it. We know there is a vaccination against the same. We know, for example, in countries where there is Ebola, there is a vaccine against Ebola. So people are given the vaccination against Ebola. So depending on the outbreak, there could be some other vaccination that will be important for a person to have. In some other areas, we know that there is Rift Valley fever, and it would be good to be vaccinated against the same. So these are the non-routine immunization that actually somebody can have so that you can get the immunity against the diseases, and you don't get the diseases. And once you get the same diseases, that will be not as severe as when you are not immunized or you are not vaccinated against these diseases. So it's very important for all of us, especially for those who have children under 5 years, to know at what particular stage does that child need to be given the routine immunization that is needed for that child, so that it can grow healthy and it can avoid preventable diseases, which can be prevented easily by this vaccination, which will give them immunity against these diseases. So it is good to know the schedule and to take this child to that particular facility, the public facility or a private facility, to get those immunizations. So we need to have what we call the mother-child booklet or the immunization card, which is used to record the immunization that the child has been given, so that it can be known what has been given and what is the next schedule. And we know in different circumstances that this is important in terms of even going to certain schools. They'll be asked, why are you immunized against this? When the child goes to visit the health facilities, they'll be asked for these records, so that they would like to know which are some of the immunization that were given, or if not, so that they can be given and they can be updated. So it is very important to not just have the immunization, but also to have those immunization recorded, and this record kept well, so that when it is needed, it can actually be referred back, and the child can be know which are some of these immunizations that were given. Then we know that sometimes, depending on the environment, for example, where there could be no potable water, the water that people are using is not that very safe in terms of contamination, in terms of getting microbes. So in these circumstances, for example, if it's cholera, the children or the people, it would be important for them to be given this immunization. If it's an area that is also affected mostly by typhoid. It will be good for these people to be given this vaccine so that they are prevented from these diseases. Overall, we know, yes, immunization protects, but once you're given this immunization against these diseases, it doesn't mean that now you lose your guard in terms of not protecting yourself from getting contaminated, not from doing the correct things, not being healthy. So beside the immunization, they have to go hand in hand by the other healthy, positive behavior practices that you need to do. One, to remain healthy. Two, to prevent yourself from getting into contact into those microbes. And three, even if you are sick or you get the same diseases, you need to take action, either to take medication or to do what is correct in terms of hygiene, in terms of washing oneself, so that you don't get this. So the immunization needs to go hand in hand with other healthy practices. And also nutrition is very important in terms of that you have adequate nutrition, and you especially once you are ill or you are sick, you need to take better nutrition so that actually your body can have the ability to repair itself. It can have the ability to fight the diseases. It can repair itself, and it can continue at a healthy state. So the immunization is good, yes, but it needs to be supported by these other important healthy practices that we are supposed to do. We'll meet till next time for another episode. Shukran for watching. وعليكم السلام ورحمة الله وبركاته.
كن سعيدا، كن فريدا، عش بفخر في الحياة، لا تبالي فالمعالي بالتحدي لا سواه. كن سعيدا، كن فريدا، عش بفخر في الحياة، لا تبالي فالمعالي